Hey, it's Nancy Shenker, and I am the geezerproofer. And I have a really, really exciting guest today. It's Robert from DDS. And you might not think that a dentist is that exciting a guest, but this one truly is. And the name of today's podcast is Open Wide. A little bit provocative and naughty there. Thank you, Rob, for coming up with that title.
It's a pleasure.
So today we're going to talk about smiles. It's the first thing people see when they look at you, and it can make a really big difference in not only first impressions, but also interaction. Because if somebody walks around with, as my mother used to say, a puss on their face, nobody wants to deal with them because they think that they're just unhappy and miserable. So, as we all know, as we get older, our teeth change. And first question, Rob, is how do your teeth change as you get older, and why do they change?
Well, first, Nancy, thank you for having me on your show. A lot of people don't always talk to me about teeth. How do they change as we get older? Well, first of all, the expression getting long in the tooth came from when the time as we get older, when our gums recede and our teeth begin to look longer. So that's where that phrase came from. But as we get older, the enamel layer that's on the front of the teeth tends to thin out. And enamel is really colorless. People think that the shade of their teeth is the enamel. It's really not. It's the material underneath called the dentin. So if you have very yellow dentin, your teeth are going to look very yellow. And as we get older, since the enamel kind of thins out, that dentin shows through more. And so our teeth look darker.
I never really knew that. And a lot of older people, they either have, what I call snaggle teeth. And as we know, in the 60s, orthodontia was not as sophisticated as it is now. So you see a lot of people with very crooked teeth, with receding gums, with teeth that are turning yellow. And then you see other people who get their teeth fixed, quote unquote, and they end up with these big white chiclet teeth. So is there anything in the middle between the chiclet teeth and the snaggle teeth?
Yeah, absolutely. You have to really know what you're doing when you're doing smile design. You have to take into account a lot of things. Now, when you have the snaggle tooth look, when people haven't had orthodontics, that can really affect how your bone stays around your teeth, because your teeth have to be in a kind of balanced occlusion. And when they're not, it can cause stresses that are traumatic. And then you get loose teeth, you get mobility. So it's important that your teeth line up correctly. And a lot of people, when they were younger, either by choice or by economics, didn't have the money for braces.
Yeah, I bullied my orthodontist, when I was 12 years old, because I didn't want to have to wear braces to bar and bat mitzvahs. So I insisted that he take my braces off. And now, of course, I regret it. But
a lot of people did that. They were uncomfortable, especially when they tighten those wires. But now, of course, we have Invisalign, which is something that as long as you wear them 24 or 22 hours a day, because you take them out when you eat. I mean, they're great. I mean, invisible aligners. But, we have to take in so many factors when you're designing a smile: the shape of the person's face, their age, the color of their skin, their complexion. There are a lot of things you have to do. So if you have a good lab, and you really have to work in conjunction with the good lab, you'll have the lab person who's designing your smile in the office with you. And then you'll look at the patient's face, the shape. Women's teeth tend to be a little rounder or softer. Men's teeth tend to be a little more square. But if it all has to do with tooth preparation, how much tooth you take off so you don't get those big bulky teeth. And you don't want a shade that looks like, neon sign. That just looks bad.
No, it does. To me, that's like the fake teeth is like the fish lips or the overly Botox
Oh my God.
faces. It's just like plastic people.
I have to tell you, I had a patient who had so much work done on her face. I can't mention her name, but against my wishes, she said, give me the fakest, whitest color you have. We had to invent a white shade for her. And her lips were so puffy, you couldn't even see her top teeth. So we worked on the bottoms. I didn't love it. I did it because it made the patient happy, but it's not something I normally do.
Well, let's talk about happy patients in the dental chair. I mean, I think a lot of us who grew up in the 60s, going to the dentist was kind of a traumatic experience, except for the fact that we got like a little toy when we left the office. But there was just like not a lot of sophisticated dentistry back then. And I think as a result, a lot of people grew up with a fundamental fear of going to the dentist. And it's one of those things where the longer you put it off, the worse your teeth can potentially get. And then the more pain and suffering you'll actually do when you sit down in that chair. So for those of our listeners who do have a fundamental fear of the dentist, other than going to a funny dentist like you, what else can they do?
Well, let's just say this. When we were young, there weren't really a lot of things called a pedodontist, a specialist just for children. I remember walking into my dental office. I won't mention his name. He was a sadist. The man had one of those belt-driven without water drills, and he didn't use anesthetic. And I'd watch my patients, my parents go through white knuckle dentistry, and it was horrific.
Like Marathon Man. Is it safe? Is it safe?
I do love that movie.
It is a great movie, but it did scare me off of having my teeth drilled for years to come. It scares a lot of people.
And to a person, the number one fear. Do you know what the number one fear in the dental office is? Besides the bill?
Drilling?
Yes, it's the sound of the drill. The sound of the drill is the thing that triggers the most fear. Not the injection, not the filling, the sound of the drill. And if you could invent a silent drill, which I've been trying to for years, you'll be a gazillionaire.
Is that why a lot of dentists today will give you headphones and let you watch TV while you're in the dental chair? Although I don't know why they always do home improvement shows in Arizona. Whenever I go to the dentist, the only choice I have is HGTV, and I usually ask them to change the
That's
channel.
because you're in Arizona. Here in New York, you can watch, all the latest crime.
Or porn.
New York One. Or porn. Yeah, that costs more. But
so when you're screaming in the chair, it's for different reasons.
Oh yeah. Yeah,
you know, I was gonna go there.
You had to go there. You have to open wide
because the show is life, sex, and tech. So I do try to cover all three of those in every show.
Well, you just want to have the teeth, make sure that they're not sharp for any reasons. If
Ooh. So speaking of things sexual,
yes.
Which of course I always do on this show.
Nice segued into that smoothly.
There has been a lot in the media lately about a correlation between oral sex and certain forms of cancer. So true or false?
Well, you'll read the literature. You haven't found out that much. You have to be careful about oral sex for sure. But it's really more of a danger if the person performing oral sex has an open, herpes lesion. Because that can be more dangerous, because if there's any open cuts on the male or female genitalia, that could be transmitted. And believe me, that can be very painful. I don't speak from personal experience, but, you have to be careful.
So HPV can be transmitted through oral sex?
I believe so. I haven't read that in the literature per se, but I have heard of it.
So watch where your mouth goes, boys and girls.
Yeah,
is
careful.
Yes, is a moral of that story.
Don't lick anything in the subway. You just don't.
Fair. So, just a little bit of advice for people over 50. Should they still go to the dentist every year? What's next on the horizon for dental care? If you grew up in that era of bad, scary dentistry, what should you be doing at our age to keep your smile sparkly and welcoming?
Well, a lot of our patients insurance kind of determines what happens, which is not always right, because they pay for 2 dental cleanings a year, 6 months apart. But we have a lot of patients who come in for 3 or 4 cleanings a year, and they do need them. That's the number one thing. Flossing, of course, but getting people to floss regularly is like, herding cats. Is really difficult. And a lot of people just aren't compliant. I floss every night. I can't
Electric toothbrush? Manual toothbrush?
Yeah, if you're going to go electric, do yourself a favor and get an ultrasonic toothbrush. You can get any one that happens to work. I happen to use something called Quip, QUIP. I get it on Amazon. It's not that expensive. It's like a pencil. It's like a jewelry cleaner for your teeth. You're cleaning your teeth really well without causing any abrasion and that can lead to gum recession. And once your gums recede, your root surface is exposed, and that's really soft. And then as you brush, you get it mortgaged in, and that leads to sensitivity. So
I happen to like the toothbrush with the timer because then I always feel like I'm brushing enough. Whereas if I'm doing it manually, I'll sometimes speed through and probably not brush my teeth.
You'd be surprised how the one you're talking about has a timer every 30 seconds and it goes to 2 minutes. 2 minutes can seem like a really long time when you're brushing your teeth. Most people brush your teeth for 30 seconds or less. Yeah,
I just wander around and do other things, look out the window, and it goes pretty quickly. It's a portable toothbrush. Hey, it can go anywhere.
I brush my teeth in the shower so it doesn't get all over the place.
Oh, true confessions here.
Do.
So you said something earlier that kind of caught me by surprise because you have all of these different brands of toothpaste that make all different kinds of promises. Mm-hmm. But when I asked you what kind of toothpaste you use, I thought you were going to give me some real high-end specialty toothpaste.
Yeah, well, no. It really depends on what you want. There's Tom's of Maine that doesn't have sugar. A lot of these things have sorbitol, things like that. But, when they say anti-whitening or a whitening toothpaste, that's really a misnomer because when you use whitening, whitening gel has to stay in your teeth for a while, for a number of minutes, for it to be effective. So when they're talking about with a whitening toothpaste, there's a layer of protein on the front of your teeth called a pellicle, and that absorbs stain. So a lot of these so-called whitening toothpaste just remove the pellicle, and then your teeth appear to be whiter, but they're not intrinsically whiter. You have to go to the dentist or do something at home to get your teeth actually whiter. So what I use, if it has fluoride and it tastes good, I use it.
So if you're looking for a new dentist, what are some of the things that you should be looking for in a dentist or a dental office?
Well, they should come to me.
Well, let's say they don't live in New York. I mean, obviously you want somebody who washes their hands or wears gloves.
Well, there's such a new trend in dentistry. A lot of the corporations, Aspen Dental, 10 Dental, they come in and it's unfortunately not always about dental care. It's all about money care. So I prefer a private office and I prefer a one-on-one with my dentist. I want to see the same person every time. And in some of these big corporations, the turnover is very high because the working conditions are not great. So look for an office where the staff is friendly, where they're willing to give you all information about insurance. And if they don't have it, how they're happy to help you with a payment plan. But it's really the cleanliness in the office. And you can't help but, look at the office and see, is it clean? Is it managed well? Is the front desk friendly? Are they nice? Are they, do they talk about, comprehensive treatment plans? Or are they just trying to replace everything in your mouth? I get all these treatment plans from other dentists all the time with stuff that people just don't need. I don't know how, as a layman, how do you tell what an honest dentist is? You come to me.
I happen to like, dental offices with comfy chairs. I find that a lot of the dental services now are being provided by the assistants, the hygienists, the office staff. And I know now to also, when I'm getting a cleaning, to ask for the person who doesn't clean my teeth as if she's like scrubbing the corners of a floor. There are a couple of them that take their jobs a little too seriously, and it can be painful if somebody doesn't know what they're doing, if they're too overly zealous.
Well, that's true. Our hygienists are very gentle. I mean, patients love them. But there are some offices, what we call expanded function auxiliaries, and they could do everything that's not irreversible. In other words, I could prepare a tooth for a crown, and they take the impression and put a temporary on it because that's not irreversible. But I can drill a tooth for filling, and they can fill it. That's great. There are some places that do that. We don't have that in New York State. That is maybe out west. I know Ohio has that. But unfortunately, I do all the work. I know, but, I'm a little OCD about it. So I like to know that I'm doing the work.
Well, thank you, Rob. This has been great. And if somebody does want to learn more about you, if they live in New York and they do want to get their teeth fixed or cleaned or whatever, how would they get a hold of you?
Well, you just look up West Side Family Dental. We're on 79th Street and West End Avenue. We've been a family practice for over 35 years. Some insurances are accepted, but you do have to check with the front desk. And come in. We have an orthodontist for braces, a pedodontist for kids, a periodontist to place implants, and a general dentist like me who restores implants and does all the cosmetic work.
So, as we started out by saying smiles, there's that corny song, "Let a Smile Be Your Umbrella."
That's very true.
Which I never quite understood, because your smile should not be held over your head. No. But smiling is important, and it is the first thing somebody sees when they meet you.
Well, they judge you by it. There's nothing you could do about it.
And since as you know, I always talk a lot also about online dating, and it's kind of shocking to me how many men, especially, I don't know, I don't look at women's profiles, but very often, they'll post pictures of themselves with, not smiling. And who really wants to go out with somebody who has a mean puss on their face?
I don't know.
And then you always have to wonder whether it's because maybe they have bad teeth. So, especially if you're over 50 and you grew up being afraid of the dentist or still afraid of the dentist, it's not something that you should put off. I'm going to sound really schoolmarmy here, but smiles are really important. And they're also really key. Having a great smile, getting your teeth whitened or getting them straightened can make a huge difference in your self-esteem as you age. And as you know, my whole philosophy is that as we get older, we don't have to become geezers. We can be beezers, people who be relevant, be happy, be funny, be in the moment. So remember, don't be a geezer, be a beezer, and continue to listen to my podcast. You can find it on Apple, Spotify, wherever you happen to listen to podcasts. And please be sure to follow me. My handle is theonswitch, TheOnswitch. I'm on Instagram, and will always post on social media when I'm dropping a new episode. So as I like to say at the end of my podcast, first of all, thank you, Rob, for your time today.
Thanks for having me.
And peace out.
Peace out.